Hi, I'm Aerin Morckel, and I'm going to be doing my presentation on the healthcare systems of Russia and the United States. Just to put the two countries into perspective, Russia has a population of 143.9 million people, and the United States has a population of 327.2 million people. So you can just keep that in mind as we go along. So the two types of healthcare systems, Russia has free universal healthcare available to all their citizens, whereas the United States has a publicly and privately funded system. So in Russia, it's overseen by the Russian Ministry of Health, and that is funded by the obligatory medical insurance agency, which is financed through employers, and the Federal Compulsory Medical Insurance Fund, and that is financed by the Budget Code of Russia. And in the United States, like I said, it's publicly and privately funded. So it's funded through government programs like Medicare and Medicaid, and 15% of the country's on Medicare and 18.6% is on Medicaid. And then also through private insurers, which is like employers, which is like a majority of the country, and also out of pocket. So population health, I did mine on infant mortality. In Russia, from 2007 to 2017, the infant mortality rate has steadily gone down. You can see in 2007 it was at 10.3, and now in 2017 it was at 6.5 deaths per 1,000 births. So yeah, you can see how it's gone down. And then in 2017, in the United States, it was 5.8 deaths per 1,000 births, which is pretty high for a first world country. I know compared to other ones. I just did a presentation in another class for infant mortality, and we used this graph. You can see how like Ohio has one of the worst infant mortality rates in the country, and it's this dark blue color, along with a lot of the deep south, and then the rest of the Midwest is also like pretty bad. So healthcare spending, that is the spending on goods and services in healthcare, which includes personal healthcare, which would be rehabilitative services, curative services, and long-term care, and also collective services, which is like preventative care. So in Russia, in 2017, they spent about $1,300 on their healthcare spending per capita, and that's compared to the U.S., which in 2017 was spending $10,200 per capita on their healthcare spending. And you can see Russia all the way down here in red is one of the lowest in the world. The actual lowest is India, which spends an average of $238 on their healthcare system. And then the average, which is like Spain and Portugal and stuff, is about $3,000. And then this one all the way to the right is the United States, and it has the highest spending per capita in the world by quite a lot. So preventable deaths, these are per 100,000 citizens. The only data I could find was on St. Petersburg, so I had to find a similar population size in the United States. So St. Petersburg had 5.4 million citizens, and so Colorado was about 5.5 million, so that's what I used. So cancer deaths in Russia were over 1,000, and in Colorado were 138 per 100,000. CBD deaths were over 2,000, and then in Colorado was only 257. Alcohol-related deaths in Russia were 495, and then in Colorado was 161, and this included the traffic alcohol deaths also. And then suicide in Russia was 206 per 100,000 citizens, and in Colorado it was only 20.2. Okay, so public and health prevention. I did mine on AIDS. So in 2004, Russia was spending about $45 million on their treatment of AIDS. That's compared to the U.S., which was spending $18.5 billion on AIDS and HIV treatment. And for Russia, only $1 million of that 45 was spent on prevention. And in the United States, $1 billion of the $18.5 billion was spent on prevention services. And then in Russia in 2017, 1.2 million people were reported having HIV, but Russia is such a large country with very rural areas, and they have very limited access to care, so that number is probably a lot higher. And then in the U.S. in 2017, it was 36.9 million people had HIV. So to combat HIV and AIDS, the United States does a lot better job at this with spending $1 billion. But I know like at OSU, students can get free condoms at the Student Health Care Services Center. And in Russia, there's no free condom system. There's no safe sex education because it's frowned upon, so they don't teach sex education in schools, and it's like against the law. So the U.S. Educates their citizens more a lot about safe sex, which can prevent AIDS. And you can see, like we all know, Africa has pretty bad prevalence rates of HIV and AIDS, and it's like this blue color, and Russia is also like similarly like bad. It's like 1 through 5%, and then the United States is this gray color, so you can see how bad Russia is compared to like the rest of the world. So the physical environment, I did mine on air quality, and this was as of February 2019. In St. Petersburg, it was, the overall pollution index was 63.31, and in a similar population city in America, which was Atlanta, the pollution index was 45.29, which is lower compared to Russia. The air pollution rate in Russia was 57.91, which was moderate. The air quality was 42.9, which was also moderate. And then air pollution was 38.89 in Atlanta, which was low, and the air quality was 61.11. So air pollution, you want it to be low, and air quality, you want it to be high. Access to care, I did mine on the mental health services. So in Russia, the number of mental health services, like the number of clinics has gone down since 2005. So since 2005, there were 318 clinics, and that have decreased to 277, which is like losing 41 clinics throughout the entire country. So 277 clinics throughout the entire country is quite low compared to the U.S., which has 4,612 clinics throughout the country. And also in Russia, their psychiatrists employment have drastically decreased from 2006 to 2013, going from 22,500 to just over 12,000. And the United States, it's about 34,400 professional psychiatrists. And so like in Russia, this means they have a lower quality of care compared to the United States. Readmission rates is 50% in Russia, with 1/3 being them schizophrenia. And in the United States, mood disorders have a 15% readmission rate, with 22.4 of schizophrenia patients being readministered. And both countries have a stigma against mental health, but the U.S. has been doing a lot more to combat that stigma. Teen birth rates. So Russia, the teen birth rates have been like a bell curve. It was low at one point in 1960, then it went up and peaked in 1992 at 52 per 1,000 births, and then in 2016 it went back down to 23 per or 2.3 per 23 per 1,000 births. And then in the United States, it's gone down consistently. So in 2016, it was at 21 per 1,000 births. So to take away, the Russia spends a lot less on their healthcare. Therefore, their quality of care is a lot lower, and their preventable deaths is a lot higher than the United States. So they could improve a lot in that area. Yeah, thank you.